point out finger to one single person, sir, ma'am, could you please call the ambulance? So that that person takes the responsibility. Or else what would happen? Either nobody will call or everybody will call. Right? So to avoid this confusion, allot the responsibility to one single person to call the ambulance. Next, talking about AED. This AED mission is nothing but automated external defibrillator. Right? So this is a device which is designed in such a way that it provides voice instructions so that even a layman could understand. It is not that we are going to analyze the rhythm or do anything. This AED is automated, it has instructions, it will tell you what to do. It would be enough if you just follow the instructions. But where could you find this? Of course, it's difficult to find on the roadside. It would be present in malls, cinema theaters, airports. At many main places AEDs are present, but we aren't aware. Right? So if you could ask the security personnel or the people who are responsible for handling all these, they will get you the AED. So whenever you are in a main place like airport, malls, any cinema theaters, try to ask the concerned person if you have a shock machine, if you have an AED, please bring it. Right? Because AED is a very important tool and it is a very life-threatening, life-saving tool in a life-threatening condition. Right? Okay. So now we have called for the emergency number and then we have asked somebody to get the AED. Next we move on to the check, pulse and breathing step. So far we have seen very simple steps. So what happens is usually we medical personnel continuously working inside hospital, our brain straightly goes to pulse, breathing, medical parameters, monitor. Right, we miss out the basic steps. So that is why I was emphasizing you the importance of checking for the response, calling for help, verifying the scene safety. These are basic, simple but very much important steps that are often missed or forgotten. Right? So once these three simple steps are done, then you go for your pulse. So of course we cannot rely on our radial pulse because it is a peripheral pulse. So we go for a carotid pulse, which is a central pulse. So we all know which is the anatomical landmark to palpate the carotid pulse. So check for pulse as well as breathing simultaneously. So when you can look at the picture, the person is bending towards the patient. He is placing his fingers on the neck and also looking at the chest of the patient. So by placing yourself in this position, you can assess both pulse and breathing at the same time. Right? And how long will you check? Just 5 to 10 seconds. Whenever it is a cardiac arrest or any life-threatening condition, we all are aware about the golden hour, platinum 10 minutes, right? There are so many concepts like this. So time is very, very important. So within 5 to 10 seconds, we are supposed to assess the pulse and breathing. So how do we count? We cannot look at watch and count. 1001, 1002, 1003. To maintain the accuracy so that you don't run 1, 2, 3, 4. No. So instead, if you have that 1001, 1002, you can maintain the time accuracy. So that is how you can check for pulse and breathing. Right. So far we have seen assessment of the patient. Now we divide BLS into 3 parts. Right. When we are assessing for pulse and breathing, there are 3 possibilities. Either pulse, breathing. Both could be present, but still patient may be unconscious. Right? That is possible. Second scenario, pulse might be present, breathing might be absent. Third scenario, pulse, breathing, both are absent. So each of these possibilities have different approaches. Right? Okay. So if there is pulse and breathing, but still patient is unconscious, what to do? What could be the reasons? Neurological, very simple ones. Hypoglycemia, right? So these are some kind of very small conditions where we see pulse, breathing are present, but the patient is unresponsive. In those conditions, of course, we are not having a tool or anything. So what are we going to do? Just place the patient in a recovery position. Could you just see the picture? What are you able to see differently in this picture? The patient is lying down, Do you find something different?
Neck is extended.
Okay. Why are the hands and legs like that? And why is the patient turned? And why do we call this as recovery position? Wonderful, aspiration. If suppose patient is unconscious, what do we do when we are feeling nauseous? We run to the restroom, vomit. But what about the unconscious patient?
Respiration.
We are going to vomit and it will go to aspirate. In order to prevent it, we are going to put them in a left lateral position and place their hand below the ears and fold the knee. Why this position? So that they do not roll over into prone position. Right? So that is the reason we place the patient in recovery position. And in addition to this, though we have activated the EMS, it is not that pulse and breathing is good. I have placed the patient in recovery position. I'll just hand over the patient. We need to keep on checking the pulse and breathing every